You're watching Discovery Health Channel and online at discovery.com.
Hi, I'm Candace, and welcome to Goldfish.
Candace Harris is a waitress at an upscale restaurant in Atlanta, Georgia.
Hi there.
Hi there.
How are you?
She's smart and attractive,
Let me get you something to drink to start with.
but feels there's one thing that's been holding her back her entire life.
It's like the one self-confidence issue I have, I guess. It's just always been that way growing up. Now, especially when you get older.
Candace never had braces. Now, as an adult, she's acutely aware of her smile and believes people stare at her teeth the second she opens her mouth.
Everybody has that one thing that bothers them about themselves, and that's mine.
Photos capture what Candace describes as a lifetime of insecurity.
I guess I smile less than I would typically. If you tell me, say cheese, I'm going to come off with this silly grin.
So now she literally counts the days until she can visit the dentist.
I'll have to try to
In this
blend
case, the
everything
dentist
in
is
so
Dr.
that
Ronald
it's
Goldstein, considered the father of cosmetic
I
dentistry.
think we can do that. Now let's
Dr.
see if we can
Goldstein
see
leads
that.
an elite team of aesthetic dental specialists in Atlanta.
Right.
Okay, I need you to open real wide for me.
Dr. Goldstein encourages Candace to invest in braces in the future, a treatment that typically would cost between $3,000 and $7,000 and yields permanent results. But right now, Candace isn't interested in an orthodontic solution. So
your
she
lip
turns
over.
to Dr. Goldstein for cosmetic enhancement.
Get her, I think, the right smile, and a smile that looks good, and I think you're going to see a big difference in her as a person.
I think either 1-in-1 or A1 are good. Let's look at
Dr. Goldstein recommends custom-designed porcelain veneers, which are secured over natural teeth.
I know that you're here for improving your smile, but Candace, I'd like you to tell me in your own words what you don't like about yourself, and I'm going to give you a mirror. Let you take a look.
Definitely the space. Seems like they're a little discolored and jagged. And the missing teeth when you do the big smile.
Do you try not to smile?
I try not to smile, but it's definitely tough.
We're going to do some diagnostic procedures because first I want to make sure your mouth is healthy.
Dr. Goldstein and his staff use a technology called digital radiography to take full mouth images of Candace's teeth. Unlike traditional x-rays, digital radiography allows Dr. Goldstein to manipulate the pictures and magnify the images for closer examination.
Essentially, I'm seeing the fact that there is a problem, I believe, in the thickness of the enamel here, and I think there's some defects. Aha, that looks suspicious right in there.
The intraoral camera reveals a potentially devastating problem.
It looks like it's starting to leak right from the sides, and if you note, there's a fracture right in between the teeth. There's a crack there.
Dr. Goldstein then uses a hard tissue laser to prep Candace's cavity for restoration.
Close all the way again and open up.
Satisfied with Candace's overall oral health, Dr. Goldstein uses technology to help design her new smile.
What I see is we filled out the area here.
The technology is called computer imaging.
Side to side.
This type of imaging allows patients to see results before work begins.
It allows us to be predictable, that I like the result, my team like the result, and the patient will like the result.
With the image approved, Dr. Goldstein goes to work.
I'm going to help reshape these teeth and make them look prettier.
Dr. Goldstein uses a tool called an ET diamond handpiece, one of his own inventions, to painlessly shape Candace's lower teeth. Simple contouring makes Candace's lower teeth look like they just came out of braces.
All right, we're going to take an impression now.
Dr. Goldstein will fit the upper teeth with ceramic laminate veneers. After studying a series of exact molds of Candace's teeth, Pinka Sadar, a ceramic specialist, crafts individual porcelain shells to fit precisely onto the faces of Candace's natural teeth.
Let me see what we're getting in the picture here.
Day 2, and Candace is back in the chair.
No.
But at the end of this day, she'll leave a changed woman.
All right, Candace, today's your day.
Because of the haphazard position of Candace's existing teeth, the Goldstein team creates veneers that not only cover teeth, but fill existing gaps.
I'm ready.
Placement is a tedious process. As the hours pass, the pieces of the puzzle begin to fall into place. But in cosmetic dentistry, the final piece is often the most difficult to place. Candace's case is no exception. She suffers from a unique hereditary disorder. When she lost a baby tooth, a permanent tooth never grew in, leaving a large gap. Now, Dr. Goldstein attempts to place a bridge to fill the hole.
Take a look.
Right now?
You don't have to.
I want to.
Now look.
1, 2, 3.
Oh, my.
Looks so beautiful.
Big smile. How they look?
I never thought my teeth would look like that.
You know, when you have a slight smile and then more.
Candace is moved by the transformation.
Oh, wow. You look gorgeous. You look beautiful.
I was emotional too. Yeah. It's why you do what you do. I mean, you don't do it for the money involved. You have to love what you're doing. And when you see someone that is affected like that, and you realize not that it looks good or she likes it, what you realize is what it can mean in the future for her. You change your smile, change your life.